Are you or someone you know struggling with the challenges of erectile dysfunction? It can be tough to discuss, but there's good news: there are solutions out there, and Medicare might even help cover the costs. The reality is that it affects millions of people, yet many don't realize that their health insurance might support treatments, including surgical options like penile implants. In this video, we'll explore how Original Medicare and Medicare Advantage can make a difference when it comes to covering treatments for ED, focusing on what you need to know about penile implants, lifestyle changes, medications, and more. So, let's break down the options and how Medicare can help make these treatments more affordable. Section 1. What is erectile dysfunction, ED? Erectile dysfunction, or ED, is more common than many people think. ED is the inability to get or maintain an erection during sexual activity. Sometimes it results from a health condition or injury, and other times it might be linked to stress, medications, or lifestyle factors. For example, surgery, like for prostate or bladder cancer, can sometimes damage nerves or blood vessels, making it harder to get an erection. Lifestyle factors like smoking, alcohol use, or lack of exercise can contribute to it. Psychological factors such as anxiety or stress may also be part of the issue. Often, doctors suggest lifestyle changes as the first step, like getting more exercise, quitting smoking, or reducing alcohol consumption. While these changes alone may not solve the problem entirely, they can help and often form the foundation of treatment plans. Section 2. How does Medicare cover ED treatments? Let's talk about how Medicare can step in and assist with the costs of ED treatment, especially for more involved procedures like penile implants. Original Medicare. Original Medicare includes two parts. Part A covers inpatient hospital costs. Part B covers outpatient medical services. Now, for ED treatments like penile implants, coverage usually falls under Part B, since the procedure is typically performed in an outpatient setting. Here's how the cost sharing works. After you pay your annual deductible, which is $240 for Part B in 2024, Medicare covers 80% of the procedure's cost, and you'll be responsible for the remaining 20% co-insurance. Medicare Advantage. Medicare Advantage, also known as Part C, is offered by private insurance companies and provides the same benefits as Part A and Part B, along with some additional perks. Since these plans vary, each may cover different ED treatments. Here are a few costs associated with Medicare Advantage plans. You'll generally have to meet certain deductibles, co-payments, and co-insurance fees. Because costs differ by plan, it's smart to call your provider beforehand to confirm how much you'll be expected to pay. Section 3. Understanding penile implants and Medicare's coverage. When lifestyle changes or medications don't work, doctors may consider other treatments, including surgical implants. Let's look at what penile implants are and how Medicare covers them. What are penile implants? Penile implants are devices inserted into the penis to allow for erections. There are two main types. 1. Inflatable implants. These can be inflated to create an erection and deflated afterward. They mimic a natural erection more closely, but they're more complex. 2. Malleable implants. These are semi-rigid rods that allow you to manually adjust the position. While less natural, they're simpler to operate. After the surgery, you'll generally need 4 to 6 weeks before you can begin sexual activity. Doctors typically see surgery as a last resort, so they may recommend other treatments before suggesting an implant. Medicare's coverage for implants. If the implant surgery is considered medically necessary, Original Medicare Part B typically covers it, following the same 80-20 cost-sharing structure. Medicare Advantage plans also cover the surgery, though out-of-pocket costs will depend on your specific plan. Section 4. Other ED treatments and Medicare coverage. Before suggesting surgery, doctors usually explore less invasive treatments for ED. Let's look at some common approaches and how Medicare helps with each. Medications. Oral medications like Viagra and Cialis work by promoting blood flow to the penis. While these are popular, Medicare doesn't typically cover them for ED. However, some Medicare Advantage plans might cover these drugs as an extra benefit, so check your specific plan details. For some other medications prescribed for ED, such as injectable treatments or alprostadil suppositories, the doctor may inject them or insert them into the urethra to increase blood flow. These medications might be covered under Medicare Part D or through a Medicare Advantage plan with drug benefits, so it's a good idea to speak with your provider. Vacuum devices. Another option is the vacuum erection device, which creates a vacuum around the penis to pull in blood, resulting in an erection. Medicare might help cover the cost of these devices if a doctor deems them medically necessary. Coverage details can vary, so again, it's wise to check with your plan for specific information. Section 5. Medigap and how it helps cover additional costs. If you have original Medicare and worry about out-of-pocket costs, you might consider a Medigap policy, which helps cover some of the expenses that Parts A and B don't, such as coinsurance for surgeries or other procedures deductibles. Medigap doesn't cover drugs, so it won't help with the cost of ED medications not covered by Medicare. Section 6. What Medicare doesn't cover for ED. As we mentioned, original Medicare generally doesn't cover drugs like Viagra that are prescribed solely for ED. However, if your doctor prescribes one of these drugs for another condition, such as pulmonary hypertension, Medicare Part D could cover it. Remember, each Medicare Advantage plan may offer different levels of drug coverage, so it's worth exploring your options if medication is part of your treatment plan. Section 7. Making the most of Medicare for ED treatments. Dealing with ED is difficult, but you don't have to navigate this alone. Medicare can help offset the costs of treatments and procedures, from medications to surgical options like implants. The best first step is to talk openly with your doctor about your condition and explore treatment options together. Once you know what's recommended, reach out to your Medicare or Medicare Advantage provider to understand what coverage you can expect. Conclusion. Erectile dysfunction is a sensitive topic, but solutions are available. Whether it's lifestyle changes, medications, or even surgery, Medicare can help make these treatments more affordable. With the right support and resources, you can take charge of your health and make choices that work for you. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell so you won't miss any of our future videos. And remember, being informed is the first step toward making the best health choices for you. Thank you for watching.